Hi friends, once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing previous year question and also important questions for nursing officer exam. If you are watching my channel first time, kindly go through my previous videos. So many questions are there. It will be helpful for your exam preparation. If it is useful for your studies, please subscribe my channel and support me. Also share my videos to your friend circle. Let's start our question. Today's first question. Fumigation is commonly associated with options. Option A, cannabis induced psychosis. Option B, amphetamine induced psychosis. Option C, alcohol induced psychosis. Option D, cocaine induced psychosis. Here our question is, the term fumigation is commonly associated with which among the following? Okay, we can see what is fumigation. Example, we can see the tactile hallucination of bugs crawling under the skin. Okay, this is the example. This fumigation means one of the tactile hallucination. Tactile means touch hallucination. Hallucination means false perception of an object. Here the bugs is crawling under the skin. Okay, that is it is commonly associated with cocaine induced psychosis. So here our correct answer is option D. Fumigation is commonly associated with cocaine induced psychosis. Here next question, what is the primary symptom of nephrotic syndrome? Options: option A, hematuria. Option B, dysuria. Option C, costovertebral angle pain. Option D, abdominal pain and diarrhea. We have to think and choose correct answer from this option. Hematuria means blood in the urine. This will not be the first symptom, primary symptom of nephrotic syndrome. And dysuria means difficulty in passing urine. This also not the primary symptom. And costovertebral angle pain also not the primary symptom. So we can select our correct answer is option D, abdominal pain and diarrhea. Here we can see the classical manifestation of nephrotic syndrome. It includes massive proteinuria, then hypoalbuminemia and edema. This is the classical symptom. Okay, here our question is, what is the primary or initial symptoms of nephrotic syndrome? That correct answer is option D, abdominal pain and diarrhea. And the next question is, what is called as window making artery? Our options: option A, right coronary artery, that is RCA. Option B, left anterior descending artery. Option C, left coronary artery. Option D, left circumflex artery. And the correct answer is, the window making artery is option B, left anterior descending artery. Move on to the next question. Sensory nerve endings located within the alveolar walls are known as options. Option A, pulmonary stretch receptor. Option B, juxtapulmonary receptors. Option C, irritant receptors. Option D, none of this. The sensory nerve ending receptors which is located within the alveolar walls are known as juxtapulmonary receptors. Option B is the correct answer. Move on to the next question. Which test is used to detect the presence of occult blood in stool? Options: option A, Forge test. Option B, Benzidine test. Option C, orthotolidine test. Option D, Guillac test. And the correct answer is option D, Guillac test, which is used to detect the presence of occult blood in stool. And the next question is, the level of care in which care is generally provided in district hospitals and community centers at block level is known as options. Option A, primordial level care. Option B, secondary level care. Option C, primary level care. Option D, tertiary level care. Here the question is, the care which is provided in district hospitals and community centers at block level is known as secondary level care. Option B is the correct answer, because once the patient is going to the hospital means they need treatment. Treatment all are case detection, early diagnosis, all are coming under secondary level of care. Okay, so here the correct answer is option B. And the next question is, which of the following neurotransmitters is decreased in a patient with delirium? Options: option A, dopamine. Option B, GABA. Option C, acetylcholine. Option D, glutamate. Here we can see the neurotransmitters in delirium. There will be decreased acetylcholine, increased dopamine and increased norepinephrine. In our question, neurotransmitter which is decreased in case of delirium is acetylcholine is the correct answer, option C. If it is increased means dopamine or norepinephrine. Okay, here question is decreased. Decreased is acetylcholine. And the next question is, what is the normal head circumference at the time of birth? Options: option A 33 to 35 centimeter, option B 25 to 30 centimeter, option C 30 to 32 centimeter, and option D 35 to 40 centimeter. Normal head circumference at the time of birth is 33 to 35 centimeter. Option A is the correct answer. And the normal chest circumference at the time of birth is 30 to 32 centimeter. Okay. And the next question is, at which age a baby stand without support? Options: option A 10 months, option B 8 months, option C 9 months, option D 12 months. Question: at what age baby can stand without support? It is at the age of 12 months or by the age of 1 year. A baby can stand with support by the age of 9 months. Okay. And the next question is, at which age child can sit with support? Options: option A 6 months, option B 10 months, option C 8 months, option D 3 months. A baby or a child can sit with the support at 6 months. Here 6 months is there, so that is the correct answer. If 5 months is in there in our option, that is also correct. Okay, 5 or 6 months. And the next question is, body temperature in neonate is regulated mainly via options: option A brown adipose tissue, option B warmth seeking behavior, option C shivering, option D sweating. Body temperature of the neonate is regulated mainly through brown adipose tissues, the adipose tissues which is seen in babies. Option A is the correct answer. And the next question is, these all questions are previous year question. Okay. Question: a mortality indicator among the following is? Options: option A disability rate, option B relevance rate, option C incidence rate, option D life expectancy at birth. Best indicator of mortality or the death rate is life expectancy at birth. Option D is the correct answer. And the next question is, clinical death is also known as? Options: option A brain death, option B legal death, option C accidental death, option D biological death. Clinical death is also known as brain death. Option A is the correct answer. And the next question is, the type of play exhibited by toddlers where they play by themselves in the presence of other children is called? Options: option A passive play, option B parallel play, option C cooperative play, option D solitary play. The type of play in infants is solitary play, and in toddler it is parallel play. That is our question. And in preschooler, cooperative play, and in school age, competitive play, and in adolescence they are playing like games and other activities. Okay, here our question is, the type of play exhibited by toddler is parallel play. Option B. And the next question is, the upper airway illness that result from swelling of the epiglottis and larynx is broadly called? Options: option A croup, option B measles, option C rubella, option D whooping cough. The upper airway illness which cause swelling of the epiglottis and larynx is called croup. Option A is the correct answer. And the next question is, nursing care that is based on identifying and meeting the needs of a patient is called? Options: option A client oriented care, option B goal oriented, option C target realization, option D prioritizing. Here the nursing care which is mainly based on the patient needs is known as client oriented care. Option A is the correct answer. Move on to the next question. The normal range of sodium in blood is, that is serum sodium level is? Options: option A 3.5 to 5.5 milli equivalent per liter, option B 135 to 145 milli equivalent per liter, option C 4.5 to 6.5 milli equivalent per liter, and option D 145 to 155 milli equivalent per liter. Normal sodium in blood or serum sodium level is 135 to 145 milli equivalent per liter. Option B is the correct answer. Normal values are Important area. Any one question we can expect from this area. And the next question is, skilled personnel who provide follow-up visit post-discharge to a patient home for the delivery of nursing services are called. Our options: option A scrub nurse, option B home health care nurse, option C clinical health care nurse, option D community nurse. Here the question is, a skilled person or a trained person who is making follow-up to the patient home, especially after the discharge of patient from the hospital, and she is providing the care or nursing services at home, is called home health care nurse. Option B is the correct answer. Okay. And the next question is, the behavior of a diabetic person who eats sweets regularly in an indication of. Options: option A denial, option B displacement, option C dislocation, option D fixation. A diabetic patient who is insisting to eat sweet regularly is an indication, that behavior is indication of denial. Option A is the correct answer. Move on to the next question and the last question, today's last question. Skin target test is used to assess. Options: option A hydration status, option B consciousness, option C level of pain, option D infection. Here our question is skin turgor. Why we are assessing the skin turgor? It is mainly to understand the hydration status. Option A is the correct answer. Or to understand the dehydration. Okay. We are discussing important and previous year questions. If it is useful for your studies, don't forget to share my videos to your friend circle.